Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about MCAS, mast cell activation syndrome, and Lyme disease and mycotoxin illness. So, histamine is a naturally occurring molecule in the body, and it's produced by a specialized cell called mast cells. And when triggered by an allergen, a pathogen, a parasite, um, something in the environment, these mast cells degranulate. And what that means is that they spill histamine into the bloodstream, and the histamine causes a whole variety of symptoms, including, rhinitis, watery, itchy eyes, fatigue, brain fog. It can even cause migraines, headaches, can even cause some joint pain. And what we now know is people with Ehlers-Danlos syndrome, when they also have MCAS, which is very common, the chronic and prolonged release of histamine aggravates EDS, and which can really cause damage to your ligaments and tendons. If you think about it, histamine is kind of acidic. It's it's on your cells. It's just brutal on your cells, and prolonged exposure to histamine can cause a lot of damage to a variety of different tissues. And so that's why, we try and get histamine and MCAS patients under control even before we treat mycotoxin illness or tick-borne illness. Mycotoxins are known to be huge triggers for MCAS. Those mast cells degranulate when you're exposed to mycotoxins in an effort to help neutralize the mycotoxin or the invading pathogen. So you want to try and get histamine under control. And one of the best ways to do that is using a supplement called Hist DAO. And this is an enzyme that chops up histamine. It's great. You take it on an empty stomach. A couple of other supplements are Quercetin, stinging nettles, and something called Sun Balance, which contains luteolin. And these nutrients are very, very helpful for calming the mast cells down and getting histamine under control. Now, oftentimes, herbs and nutrients are not strong enough to get the MCAS reaction under control. And so you need medications like Allegra, Ketotifen, Benadryl, Zyrtec, and H2 blockers and H1 blockers both. H1 meaning histamine 1 blockers, H2 is histamine 2 blockers. And these medications, coupled with nutrients, like I said, Hist DAO, Quercetin, Nettles, Luteolin, can really help stabilize the mast cells, or at least move the patient in that direction. You have to stabilize the mast cells first before you start treating mycotoxin illness or mold illness. It's just not going to work if you don't, because histamine will be out of control and it will get more out of control. And one of the main symptoms of MCAS patients is they have a lot of food allergies and a lot of environmental allergies. And so their histamine is just running rampant. And they will have a lot of histamine-like symptoms. So first thing you have to do is get MCAS under control, and that might take a couple months before you start treating tick-borne illness and mycotoxin illness and COVID, because a cytokine storm can also trigger a release of histamine, and then you've got that to worry about on top of everything else. So I mean, histamine is a beneficial molecule when it's released in moderation and in response to particular allergens or antigens. It can become out of control, and it is largely genetically determined. Now, not everybody's genes are expressed, so you might have the genes for MCAS, but you don't have MCAS, and that's great. You're lucky. But a lot of people do have the genes for MCAS, and they're fine until they get a bad exposure to mold, mycotoxins, tick-borne illness, COVID, and that just activates and turns on those genes. So you want to try and stabilize the mast cells right out of the gate, and then you can move on to treat the other infections or mold illness. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.